Traumatic experiences can leave a lasting impact on a person's mind and how they cope with challenges. While some openly express their distress or seek comfort from others, others may develop a strong sense of self-reliance as a way to protect themselves from further pain. Psychologist Dr. Amy Marshall explains that this extreme independence is often a defense mechanism, helping individuals avoid vulnerability. However, while independence is generally seen as a positive trait, excessive self-reliance can lead to emotional detachment and isolation, making the healing process more difficult. One sign that hyperindependence is linked to trauma is a reluctance to seek help. According to counselor Dr. Joanne Frederick, past trauma can create a belief that relying on others leads to more pain and disappointment. As a result, those who are overly independent may distance themselves from others and refuse assistance, convinced they must handle everything alone. Unfortunately, this only deepens feelings of isolation and adds to the emotional weight of their trauma. Similarly, refusing to accept help is another common behavior. Even when genuine support is offered, hyperindependent individuals may struggle to accept it. Dr. Amy Marshall explains that this reaction comes from a deep-seated belief that accepting help is a sign of weakness. Many feel an intense need to prove they can manage everything alone, even at the expense of their well-being. However, this constant self-reliance can lead to loneliness, exhaustion, and emotional burnout. Another challenge is difficulty in expressing vulnerability. Do you find it hard to open up about your feelings? Does sharing emotions make you uncomfortable? Clinician Dr. Trish Kaha explains that those who struggle with hyperindependence often build an emotional barrier around themselves. This is often due to past experiences of betrayal, abandonment, or broken trust. Because of these negative experiences, they fear that being vulnerable will only lead to judgment or rejection, so they suppress their emotions instead. Emotional self-neglect is another clear sign of hyperindependence. Many become so focused on staying strong and self-sufficient that they overlook their own emotional needs. Dr. Marshall notes that this is why hyperindependent individuals often experience chronic stress and burnout. They prioritize tasks, achievements, or helping others while ignoring their own struggles. This can show up as avoiding emotional support, refusing to discuss personal challenges, or suppressing emotions to the point of feeling numb and disconnected. Fear of intimacy is another way hyperindependence manifests. Psychologist Dr. Annie Tennis-Sur explains that forming close bonds requires trust and vulnerability, something that can feel overwhelming for those with past trauma. To avoid potential pain, they keep people at a distance, but this emotional guardedness prevents them from building meaningful relationships. Instead, they become stuck in a cycle of self-reliance, believing they can only depend on themselves for support and validation. A constant need for control is another common trait among hyperindependent individuals. Dr. Marshall states that if trauma has taught someone to rely only on themselves, they may resist depending on others or even having others depend on them. They strongly believe that the only person they can truly trust is themselves, and they expect others to adopt the same mindset. As a result, they feel the need to control every aspect of their lives, struggle to accept outside input, and avoid delegating tasks for fear of failure or disappointment. If you found this discussion helpful, you may also be interested in our video on 5 ways trauma might be affecting your relationships. Recognizing the signs of hyperindependence is the first step toward breaking free from its grip. Seeking support from trauma-trained professionals can help you cultivate self-compassion and healthier connections with others. Healing is a courageous and transformative journey, and no one should have to go through it alone. Vulnerability is not a weakness, it is a reflection of inner strength and resilience. So, ask yourself, how might embracing vulnerability and accepting support help you heal and grow beyond your past experiences?